Well, I started out in life as a garden variety gastroenterologist, fully expecting that my career would involve putting endoscopes into people and looking around inside. But I quickly learned that about a third of my patients had physical symptoms not related to anything that I could see with diagnostic tests, but instead connected to stress. And that if I was able to uncover what the stress was, and it wasn't always obvious what it was, but if I could find it, we could almost always treat it successfully, and then the symptoms would come down, and in some cases go away completely, and in a few other cases go away completely in a very short space of time. So that became, instead of one of the more frustrating aspects of practice, which it is for many physicians, it became one of the most rewarding. And I did that for, from 1984 onwards, over 7,000 patients with those problems. Well, these were patients who had no organ disease or structural abnormality that could account for their symptoms, but I could tell that it was a stress-related illness by uncovering what the stress was, treating that, and then seeing that patients got better. That was the confirmation that I was on the right track. And it took me hundreds of interviews every year for 4 or 5 years before my learning curve finally reached a decent level. And then another decade after that of experience before I felt ready to actually write a book about it that would be meaningful and useful to patients. And it took me 3 years to write it. I kept editing it over and over again to try to make it as clear as possible, put it in simple, straightforward language that people could connect with, that there are a lot of case histories in it that are drawn from the full spectrum of different kinds of stresses that can make people physically ill, with the idea that one or more of those stories would resonate for a reader in a way that would give them insight into their own personal situation. And it's been very popular. Once it came out, I started getting invitations to speak all over North America and Europe, over 100 television and radio broadcast interviews, teaching in 2 or 3 different graduate schools. The interest in this has just exploded, which is wonderful to see because it's been a huge blind spot for the healthcare profession for centuries. One of the reasons why I pursued work in this field was that, to me, this is a justice issue, that a human being who is suffering should be able to get appropriate diagnosis and relief of their symptoms, if it's possible, from the healthcare system, no matter what is causing their illness. If it's a structural abnormality or an organ disease, the system is very good at helping people with that problem. If their exact same symptom is caused by stress or by repressed emotions or by low self-esteem or by poor self-care skills, the system typically flails at that, or is ignorant of what to do, or simply places those patients outside of its job description. And for me, that is totally unjust. If you are 2 people are suffering the same symptom, they should be able to receive the same quality of care.